So what is sleep? How is it so important? Why is it so problem if it's affected? Well, one of the main things is insomnia. So if you have insomnia, what it actually ends up disrupting is going to be the sleep cycle. The sleep cycle is made up of two different phases, NMR, and then REM sleep. REM sleep is rapid eye movement, and then NMR is non-rapid REM sleep. From there, what it does is non-rapid has 3 different stages, N1, N2, and N3. 1 is going to be the most conscious, and then N3 is going to be your dream state. Most normal people start at REM sleep and then go through the non-REM sleep cycles. So then you transfer back between N3 and 2 the rest of the night. For someone with insomnia, they can actually go from a REM 1, 2, 3, 2, and then back to 1. So some of the causes of insomnia would be anything from anxiety, nasal pressures, even just something as severe as hyperthyroidism, even Parkinson's disease. So if those are causes, what are going to be some of the things that are specifically known as insomnia? So there's 2 different distinct types of insomnia. There's going to be onset and maintenance. Onset is going to be the stereotypical one where people know, and that is going to be the one where it's hard to fall asleep. Versus maintenance is going to be where you have a problem. Once you fall asleep, it's hard you will wake up continuously. This is the people that will suffer from having the N1 and N2 stages of sleep disrupted. And then there are 2 specific other subsets of that, which is going to be chronic and acute. Acute is going to be the lesser of the 2. It's going to happen once or twice a week and can last up to a month. It's something that is happening in your daily life. Versus chronic is going to be something that lasts 3 or 4 nights a week and can last up to a couple months. This one is usually medically conditioned, and it can have a problem with it. So from there, if you know you have insomnia and you know the causes, what would be the next step? That would obviously be how do you get diagnosed? Well, one of the things you can do is to get diagnosed is go see your doctor. From there, he can ask you simple questions like, are you in pain? Is it chronic? Do you have any new medications? Is it prescribed even over-the-counter drugs? What is your sleep cycle like? Are you lethargic? Do you exercise? And then if you answer yes to those questions, he can either diagnose you as insomniac or he can send you to go get a polysonogram. This will read your brain waves and your beta and alpha data waves through your N1, N2, and N3 sleep cycles. From that, they will be able to try to diagnose you as insomnia, or they can use the polysonogram to even find if it's another sleep-related element. So they can also measure stuff like O2 pressure in your nasal capacity, any type of oxygen in your blood, how fast your heart is beating, your eye movement, anything like that. So that is why the polysonogram is so important. From there, what would you do next with the diagnosis? You would try to get treatment. So there are 2 different types of treatments you can do, which is going to be medical or non-medical. For medical, you can do stuff like go to your doctor and get a sleep aid, or you can do supplements, anything like that. From there, you can go and you can do non-medical, which is going to be different therapeutic treatments. One of the big ones is cognitive behavioral therapy, which is going to be you train your body in order to know when sleep is. You train your brain in order to know your bed is specifically for sleep. If you cannot sleep within 20 minutes, you get out of bed and you do something else. And then you return back to bed once your brain is tired. And you repeat that cycle. If you stay in bed longer than 20 minutes, you're training your brain that bed is no longer for sleep. It is associated with something like TV or reading or relaxation. So those are some of the symptoms of insomnia, what it does, and how it affects you. Hopefully this has helped you with your presentation. Thank you so much.